All right, welcome back to another episode of Cameo Podcast. I'm sitting here with Dr. Ian Mitchell, who I'm so lucky who agreed to meet with a bona fide stoner, even though I'm probably not as big of a cannabis user as some of you may know. But Dr. Ian Mitchell is going deep into the research of cannabis and is kind of at the forefront of it, paving the way for really just the next wave of cannabis, and I really just want to get his thoughts as someone who is really just a stoner. I want to bring some research into it because there isn't a lot of research about cannabis, and so that's why I asked Ian to chat with me. Ian, Dr. Ian, how should I refer you first?
Ian's fine.
Ian, how do you describe yourself to someone who comes up to you and says, "You're a doctor. Why are you smoking weed, or what are you dealing with weed right now?"
I started off as an emergency doctor, but I've even before that I was a student in pharmacology. I did my bachelor's degree in pharmacology at the University of British Columbia, so I've really been studying drugs for over 30 years. So I've always just had an interest in the area, and cannabis is obviously a pretty hot button topic right now. My own interest came as an emergency physician in Kamloops, seeing a lot of chronic pain in the community, and a lot of chronic pain being treated by opiates, and mostly looking at trying to provide an alternative for that population, and kind of that was my real entry into the field.
Yeah, okay. And as someone who does use cannabis, and I try to use that word more than any other word, how do you feel about calling it a drug? At this day and age where stoners like myself are like, oh, it's not a drug, it's cannabis, or it's weed, it's medicine. As a professional in medicine, what's your take on that?
Yeah. Well, I mean, it's a drug. I mean, you can't say it's not a drug because, that's what I started off learning in pharmacology. Well, what's a drug? It's something that has an effect on the human body. Okay, well, cannabis certainly has an effect. That's really clear. So there's no way you can say it isn't a drug. But that kind of terminology is lost on the population as a whole in a lot of ways, in that alcohol is a drug.
Caffeine is a drug.
Caffeine is a drug. All these things
Sugar,
are drugs.
Would you count sugar as a drug?
Sugar is absolutely a drug. So all these things are drugs, but we don't use that word in the same sense, even though alcohol is certainly far more damaging as a substance for people to consume than cannabis is.
Absolutely, and I have my own struggles with alcohol myself, which was a negative outlet of stress for myself, and hopefully I found a positive outlet through cannabis. But as a younger man and who approached my doctor when I was under 25, and she rightfully so rejected my request, what is the science now saying about younger adolescents and using cannabis, or is there enough research into that?
Well, there's been so much research done about that. Really, we've had no shortage of research into the harms of cannabis. We've really been prevented from doing much research into the benefits of cannabis, but the harms are pretty well understood by now. And what we understand is that for young people, there are some additional risks, and particularly those are with schizophrenia. And that's not to say that cannabis causes schizophrenia. There's no evidence that's the case. What we know is that people who use a lot of cannabis at a young age, who are going to get schizophrenia anyway, may have an earlier onset of symptoms or may have more severe symptoms if they use cannabis. Therefore, the really sensible thing is those people should not use cannabis, and that's kind of a very straightforward thing. The more complicated issue is with cognitive impairment, and there's been lots of concerns about 13-year-olds just smoking pot in their basement all day, playing video games, and I'm certainly going to agree that's not the way to a Nobel Prize. But it's a different matter to answer the question, is that going to negatively affect their brain, particularly for the rest of their life? And what we found is that a recent meta-analysis was released a couple of weeks ago showing that the concerns about the effects on cognitive development have been largely overstated. That really after you wait 3 days, you test people, you cannot show any cognitive impairment after years of use. So certainly you can be impaired while you're using cannabis, and to some people that's kind of the point. But to suggest there's long-term impairment just isn't borne out by the studies.
Absolutely, and you actually spoke at length about impairment at a recent cannabis conference in Vancouver called LIFT. The use of cannabis while driving impaired. I think if I understand I don't want to twist your presentation, so I want you to say it yourself, but it sounds like it doesn't really impair, or the people who are going to drive impaired aren't impaired. Is that a fair assumption?
Well, I would say, I don't think you're going to find anybody who's saying that cannabis isn't impairing for driving. The thing is, it's just not very impairing, especially compared to alcohol, which is massively impairing. So if you look at the odds of being in an accident, kind of all comers, not looking at blood levels, if you look at cannabis, it's going to increase your risk by about 60%. For alcohol, it's going to increase your risk by about 1,600%. So It's really kind of magnitude of difference. Now, obviously, that varies depending on your blood alcohol level. But what we know is that we can't really show that people who've used cannabis are more impaired than people who have a blood alcohol level of 0.05, which is legal federally, and is subject to some penalties in BC, but nowhere. So we're really over-penalizing people. And the really interesting thing that's come out since that talk was some very cutting-edge research from Jeff Brubaker at Vancouver General Hospital, looking at the very specific blood levels that are going to be penalized in Canada. So the federal government is making it a crime to drive if you have above 2 nanograms per milliliter of THC in your blood, and that's a financial penalty, and then you can go to jail if it's more than 5. Now the problem is that in this new study that was released, that they couldn't really determine any level of impairment from those blood levels. So what we're setting out to do is criminalize people that have no scientifically confirmed impairment, which is really concerning, and that's going to lead to some immediate constitutional challenges.
Absolutely. I tried to explain impairment to my parents over the weekend, and because they were visiting, and I was smoking throughout the weekend, throughout the day, small amounts, to a level where I'm happy and consistent and productive, and they certainly couldn't find impairment in myself. And if they did, they weren't verbal about it. And then secondly, I actually have a friend back in Ontario who took her driver's test. Blazed is the term that she used. Yeah. And she's always done things to that level. If someone is acknowledging that they're getting blazed, is that a way of registering impairment? But if they're still able to drive, are they then impaired? Like, how do we quantify that if it's something someone's actually physically saying?
Well, this is what we kind of need to get is what's the level of impairment present. So you can't really base that on a blood level. It just doesn't work for cannabis. It works for alcohol, but the blood levels don't concur with your impairment level. So ultimately what we need is the tests that test impairment. So if she gets out on the side of the road and does all the tests where you're touching your nose and that sort of thing, well, she probably would fail those. Or she may fail those, or she may be more impaired than she expects from her driving. People who do pretty routine tasks tend not to show much impairment. It's when they kind of have to do a challenging kind of thing that they may show more impairment. That's obviously a problem. But what we're ultimately looking at is we need to find functional tests of impairment. So there's some interesting apps. There's one called Druid, which I mentioned in my talk, and you can download it to your phone or whatever, and you hold it in the air and it tests your balance, and you have to do little tests on it, and it can tell you what your impairment level is.
Oh, interesting.
And if you should be driving or not. Okay, so it gives you, now I don't think they ever say, no, you should drive kind of thing, but what you can do is you can establish a baseline of what your normal is, you can test that against alcohol and cannabis.
That's really interesting.
And I think that's a much, much better way for people both to appreciate that sometimes they can be impaired, but also to give themselves an idea of like, maybe I shouldn't drive right now. Maybe I need to wait for a while.
Absolutely. And as someone who wants to kind of be at the forefront of encouraging people to use cannabis to be productive, because I think it does make me more productive, I don't want to get behind the wheel myself at all. But that's very interesting that now there is, kind of an open source or a way for people to get an idea of impairments, because that is definitely a difficult word or a difficult notion to overcome. What are some other things that you're really excited about with cannabis that are coming around the corner that the general populace might not know cannabis is opening doors to?
I think we're going to see a lot more use of topicals. That we're going to see the CBD and THC topicals come out in a big way for people. They're being massively adopted by medical patients. There's no risk of psychoactivity, and people are getting great results on their skin and their joints.
Psychoactivity is, when people get stoned, that is what psychoactivity is, just to pull back, right? So THC is the psychoactive component. There is umpteen dozen other cannabinoids out there, and we only know, 60, if that? Is that...
Yeah, well, there's at least, there's hundreds of cannabinoids out there, and just THC and CBD are the ones we're more familiar with. And yeah, so I would say that CBD is psychoactive, and it still has some effects on the psyche. It's used for anxiety purposes, but it doesn't tend to be intoxicating.
Okay.
And so, and that argument is going around, like, what's the right word for THC versus CBD as far as its effects go?
Okay, cool. And yeah, I've used CBD quite, a high CBD strain to recover from a long run before. And the effects were amazing. I went from being stiff and not being able to barely move to essentially walking like I never ran 50 kilometers previously. So, I can attest to the power of cannabis. And so in this time while we're trying to figure out the legalization of cannabis, what are some things, the average stoner like myself might need to keep in mind to kind of stay on the right side of the law, but still maybe safely practice using cannabis? There's some suggestions that you might have, if you feel comfortable?
I think, as a physician, I don't want people to smoke anything. So I think one of the big booms is going to be in vaporizers and vape pens.
Edibles.
Kind of thing. Edibles are just becoming massive from a recreational sense. So that's going to take off. And I think the thing that I'd like to see is I'd like to see a lot less consumption of alcohol and kind of that being traded off with cannabis in a recreational sense, because I think that's the way to better public health outcome.
Totally. I can attest to where alcohol takes you as an alcoholic myself, who then uses cannabis daily, and I still have my own stresses and problems, but I truly believe that it helps me manage that. Ian, I appreciate you speaking with me today. We're coming around to near the close.
One last thing.
And I want to open this up to you to kind of share whatever you want. Where can people find you? Or lead me down a new path of cannabis that I haven't yet taken.
Sure. Just one last thing I'm thinking of before we end up. There's actually some really interesting research around liver health. And just while we're on the topic of alcohol, and for a long time, if you were a cannabis user, you were banned from getting a liver transplant because it was felt that that contributed to a worsening outcome, and that the use of cannabis was associated with liver fibrosis or more scarring within the liver.
God forbid any alcoholics need a liver transplant.
As it turns out, the more recent studies are showing that that cannabis actually has a protective effect on the liver in people who are using alcohol, and it seems to slow down the transition from alcoholic hepatitis to alcoholic cirrhosis, and actually leads to a decreased risk of getting liver cancer in people who have misused alcohol. So I just think that's a kind of really interesting, again, another counterpoint to something we're introducing into our society.
Totally. I actually went down that road where they were looking at my liver quite intensely. It ended up being quite a cancer scare. And they just had me poop in a cup, and that solved everything. But it was quite interesting because I came across that research where I was reading cannabis could fix my liver, and because they thought for a time being that I had scarring or something was going on in my liver. It turns out I just have big veins or something like that.
But if anyone's interested in kind of learning more, I have a website that you can search for. It's Cannabis 101, and just Cannabis 101 Ian Mitchell. You'll find that up on Medium, and it's just something I keep adding to for general information for people. Yeah,
Dr. Ian Mitchell is his name. You can easily find him because, it's going to say cannabis about 5 words after his name. Actually, can you solve one quick argument I have with my wife?
Yeah. Okay.
Does cannabis decrease my men?
Good question. So the answer to that for a long time was a little bit of a concern was raised that cannabis can change some sperm motility, make them look kind of funny. and maybe some of them swim a bit weird. So that was kind of been known for a while. However, again, newer research shows that it doesn't seem to impair fertility. So you seem to just get...
It's all good.
It's still
that
effective.
3 months I took off wasn't necessary.
Well, I think we just don't know to that extent. So I'm never going to say that's a bad idea. And that kind of brings up pregnancy as well. That's a whole other kettle of fish.
Yeah, that's something that needs to really be researched.
And we still don't know the answer to that. So reproductive issues, I would say we don't know enough yet, but I don't think it's as dire as some people might make it out to be.
Awesome. Well, thank you once again, Ian, for agreeing to meet with a stoner like me in a coffee shop to talk about cannabis. And I look forward to, I always follow you on LinkedIn. You're always posting interesting articles, interesting takes on the growth of the industry, and you're just posting about wine in our grocery stores next to Kinder Eggs. But thank you so much for agreeing to meet with me, and I look forward to following you as you continue to research cannabis and take us to the forefront of a really, really exciting time.
No problem.
Cheers.
Good to have a conversation.